minutes, actually over 20 years of work on the development of a therapeutic for aging disorders, including Alzheimer's disease. The drug is an antibody blocking the action of a reproductive hormone called FSH. So Alzheimer's disease is a crippling disorder predominantly affecting older women. So women has a very high incidence of Alzheimer's disease. 2 out of 3 Alzheimer's disease patients are women. And in addition, they have a higher risk, lifetime risk, getting Alzheimer's disease. And they are also having a faster disease progression as well as a more severe symptom burden. So for a long time, people try to attribute this difference, men and women, to loss of estrogen after menopause. So after menopause, the ovarian function fails, estrogen output is very low. And so multiple clinical studies suggest that estrogen might not be the cause, because in some studies, estrogen replacement therapy in postmenopausal women help improve memory in these women. But some studies shows no effect, and even worse, a few shows that women getting estrogen replacement get worse memory. So these studies are not very consistent. So we think out of the box. So and a reproductive hormone, FSH, is actually upstream of estrogen. And after menopause, estrogen loss leads to a high elevated FSH, as you can see on the right side. And so we're thinking, how about FSH? Could it be a targetable, could be a target for a drug that can improve Alzheimer's disease? Now, first, we actually identified receptors in the brain for FSH, and they are present in the hippocampus, in neurons in the hippocampus. The hippocampus is a brain area that is responsible for memory functions. So we showed in this study, in the mouse brain as well as in human brain, the receptor for FSH is present in the hippocampus. Next, we perform animal studies, injecting. So if we take out FSH receptor in the brain, we show an improvement of memory in the mouse. These are behavioral testing, and if we do genetic knockout, the knockout animal without FSH receptor in the brain, they perform much better compared to the wild type. And so we are thinking of how can we help Alzheimer's disease patients? Can we block the action of FSH? Because FSH seems to be the culprit of Alzheimer's disease. So we generated a monoclonal antibody to block FSH action. And this is a crystal structure showing that FSH antibody actually has high affinity to bind to the ligand FSH. And in a all right, okay. Where's the mouse? Can you help me? Run the top one. Thank you. So what we use is 2 attributes of memory. One is spatial memory. Alzheimer's disease patients lose spatial memory, and the bottom one, please. And so if you leave someone with AD on the street, they will have problem getting back home because they lost the spatial memory. And in this test, we put a mouse in the water tank, and over time they get trained to find a hidden platform that they cannot see. So mice, they can swim, but they don't like to swim. And if you put a mouse with good memory, they will find the platform very early, with 10 seconds or 15 seconds. The animal up in the top panel, they lost memory, and you see that he's trying to find the platform and never found it. And so this is one of the testing that we performed in the lab to show that injection of the antibody, which is the lower panel, helps Alzheimer mice to recover the memory. On the left side, this is a recognition test. So Alzheimer's disease patients also lose recognition memory, meaning that they do not recognize, for example, their relatives, their children, they don't recognize them. So how do we ask the animal, do you recognize someone? So in this case, we use a behavioral test where we put two identical objects in an arena and put a mouse in the arena. A good animal will, or mouse being very curious, they will explore and look at these objects. Okay, we give them time, 10 minutes, to acquire the object. Okay, and then a few hours later or a day later, we can do different testing. We put the same animal into the same arena, but replacing one of the identical objects with a new object. So an animal who has good memory will remember, I have already seen this shape. The animal will explore the new object more time. So this is one way that we can test whether the animal has good recognition memory. And injection of our FSH blocking antibody improve also the recognition memory. And being a reproductive hormone, FSH blockade, actually in our hands, do not, the blockade has absolutely no effect on reproductive function, in the mouse at least. And in terms of pharmacokinetics, we found that the half-life of these antibodies in the bloodstream is about 2 weeks. So meaning that if we do injections every month or even every 2 months, there should be enough antibody for the action. In terms of pharmacodynamics, indeed, the FSH antibody binds to FSH. So in blue, in green, this is the free FSH in the blood. And injection of 100 micrograms of this antibody absorb all the free FSH, and these are all bound. Total remain the same. And in terms of distribution of the antibody in the animal, indeed, there's this distribution to the brain. Although small, it does go into the brain. But we don't actually need the antibody getting into the brain because you can take out FSH in the circulation. And I'm also showing other targets, which I will talk about in a couple of minutes. It also goes to adipose tissue, fat, as well as the skeleton, bone. In terms of safety study, is the antibody safe? We use monkeys for this study. So injection of FSH antibody in the monkey over 5 months. Each month we give them 1 injection. Over 5 months, in this slide, I'm showing you the vitals, heart rate, blood oxygen, body temperature. They are all within the normal range. In terms of biochemistry, all the biochemistry are within normal limits, as you can see from within the gray zone. Here, this is the result of the blood count, they are all within the normal range. So this is a antibody that is safe in monkeys. And in addition to Alzheimer's disease, women also suffer two other disorders postmenopausal. So women after menopause lose a lot of bone, and also the menopause is it also coincides with the onset of obesity. So we're thinking, how about can we use the antibody for these two other items, obesity and osteoporosis? Indeed, if you look at the estrogen level, estrogen, again, in this perimenopausal period, they are within the normal range, but FSH is rising. There is a very dramatic loss of memory during this period of time in women. There's a lot of bone loss also coincide with the perimenopause, as well as obesity, weight gain. So we think, oh, could it also help osteoporosis and obesity after menopause? And so we perform studies in the mouse using the same water maze test, as well as we will measure fat mass and bone mass. So I already showed you the memory, but here we're showing you that fat mass after injection of 100 micrograms of the FSH antibody, you can see that there's dramatic loss of fat mass as well as body weight. The bone density also dramatically improved in this animal model. So all this work, thanks to the scientific community, it get a lot of coverage. Nature Medicine named our study as one of the 8 notable advances in biomedicine in 2017, and New York Times talked about it, and Nature also talked about our brain work. So in summary, this is over 20 years of work. We now have a candidate that can be used for 3 human aging disorders: osteoporosis, obesity, as well as Alzheimer's disease. Thank you for your attention. Thank you, Dr. Yuen.